Good morning, ladies and gentlemen, and a very warm welcome to this early session on climate change and health inequalities. My name is Aleksandra Kaźmierczak, and I am from the European Environment Agency. This session is organized by the European Commission, specifically by the Directorate-General Research and Innovation, and also by the European Commission's initiative called European Climate and Health Observatory. Within the European Climate and Health Observatory, we work together with a number of partner organizations to develop the knowledge on climate change impacts on health and also on solutions. And some of those partner organizations are here with us. So please let me introduce our fantastic panel of speakers. So starting from my left, we have Maurizio Curtarelli, who's a senior research project manager at the European Agency for Safety and Health at Work. Then we have Jan Semenza, who has many hats on. He's from Heidelberg University, Umeå University, but also is here representing the Lancet Countdown in Europe initiative, as well as the climate health cluster of research projects. Next to Jan, we have Rita Arusho, who's a team leader on environment, climate and health at DG Research and Innovation at the European Commission. Next, Rita, we have Francesca Racioppi, who's the head of office at the World Health Organization European Center for Environment and Health. And last but not least, we have Vania Putati, who's a policy coordinator at EuroHealthNet. EuroHealthNet is not part of the European Climate and Health Observatory, but we're friends anyway. So let me tell you how this session will be run. We will start with the first round of questions to our panelists to learn more about the state of play in climate change and health inequalities, but also to learn about what those important organizations are doing about it. Then we will turn our attention to you, and we will ask you to actively participate, to ask questions, offer your comments and reflections. And we'll also ask our audience online to contribute. And we will have a slide poll on the most important actions to take. And we'll finish off with another round of questions to the panelists. Okay? So, let me start. Climate change, of course, affects people in different ways. And one important area of our life, of course, is work. We spend a lot of time at work, and whilst here we are in those beautiful surroundings, many of us are not so lucky to be able to choose where and how we work. So first, I wanted to start with a question to Maurizio. I understand the European Occupational Health and Safety Agency has recently run a survey to investigate a bit the climate change impacts at work. So please, Maurizio, tell us a bit about it. And have you seen anything in relation to inequalities through the results of that survey?
All right. Good morning, everyone, and many thanks for inviting me to this panel. Yeah, climate change is definitely an important topic on which we are currently working. We have initiated a research program at the beginning of this year involving a number of research activities to investigate more in depth what are the implications for occupational safety and health of climate change. In this context, we ran a survey in spring this year, in 2025, on a representative probabilistic sample of 28,000 workers across the European Union, in Iceland, Norway, and Switzerland as well, in which we covered several topics. We asked workers a number of questions on topics like digitalization, psychosocial risks, health outcomes, etc. And one of the topics was about climate change. The results were published last week You have on this slide the QR code through which you can access all the publications that we have produced, and more are to come, because we plan to have more in-depth analysis of data, also in combination with other more qualitative research. So one of the questions that we asked workers regard the exposure to climate change-related risk factors. We asked workers if in the last 12 months they at work were exposed to the following factors: extreme heat, either indoors or outdoors; air quality issues such as pollen, dust, or smoke, either indoors or outdoors; intense sun; and extreme weather-related events such as floods, wildfires, droughts, or hurricanes. And the finding display, which is quite impressive, that across the European Union, 1/3 of workers report being exposed to at least one of these 4 climate change-related risk factors at work. 20% of workers report exposure to extreme heat, 19% to air quality issues, 12% report intense sun exposure, and finally 9% report exposure to extreme weather-related events. We also asked workers if they are worried about the impact of climate change. This is an important indicator because it's a predictor of mental health issues. And we found that 30% of workers report that they are worried that climate change-related issues can impact their safety and health at work. 20% of workers are afraid of that their current job and tasks will change as a result of measures introduced to tackle climate change-related risks. Now, we obviously observed a wide variability from a geographical point of view, reflecting different impacts of these specific risks in the different geographic areas. But what was more interesting, in my opinion, is that we could also observe a great variability of these indicators, exposure to risks or concern about climate change, among groups of workers, depending on the specific characteristic of the workers, on the characteristic of their job, and the tasks that they perform on daily basis, and depending on the sector in which they operate. So, for example, we see that age is a predictor of increased exposure to risks related to climate change or to increased concern, with older workers more exposed to this kind of, more likely to report this kind of exposure. Male workers are more likely than women to report exposure to risks and to be concerned about the impact of climate change. Migrants are more likely to report exposure or concern than national workers. Looking then at the characteristics and types of jobs, we see that workers in non-managerial jobs or working outdoors, such as an outside site like a construction site or an agricultural field, report to be more exposed than other workers. Working in manual jobs, in skilled, semi-skilled, or unskilled occupations is also a predictor of increased exposure to risks related to climate change, with farm workers who report the highest exposure to risk related to climate change. Sectors, looking at the sectors, agriculture, construction, manufacturing, and transport, accommodation, and food services are those where workers feel more exposed to these risks. What are the implications in terms of workers' health? First, we observe an association between exposure to risks and the likelihood of experiencing health issues, health problems. So workers who report having experienced health issues because of their work in the last 12 months are more likely to report any exposure to any of the risks related to climate change. Second, we asked about specific health issues, for example, heat-related symptoms or illnesses that are reported by 7% of workers, or sunburn that is reported by 3% of workers. Now, beyond the geographic variability of these indicators, we observe that there are specific groups that report an increased prevalence of these health problems. Again, workers in manual occupations, working outdoors, for example, or in sectors that I mentioned earlier, are all more exposed than others. And finally, we observe an association between concerns about the impact of climate change and increased mental health issues, with workers that report this kind of concerns and worries more exposed to report as well, for example, stress, depression, or anxiety problems. So, in conclusion, and I'll stop here, we observe that climate change does not impact workers all the same way. There are specific groups of workers that are more impacted by climate change. And these require, obviously, an increased attention from our side, from employer side. Employers need to deploy a range of measures to protect workers, to prevent risks, probably also with the support of public authorities in this. And I stop here, and I give the floor to the next panelist. Thank you.
Yeah, thank you, Maurizio. I think it was a fascinating insight into the inequalities that occur at work in relation to climate change. And now turning to Jan, who's representing here the research community, and notably the Lancet Countdown in Europe Adaptation Working Group. Jan, do you think that we are actually able to recognize all the vulnerabilities to climate change in Europe, and are we able to reach out to the most vulnerable groups? What's your experience of that?
Yeah, thanks, Alexander. I think I'll get out of the limelight here so I can see you better. So 30 years ago, I was asked to lead a CDC response to the heat wave in Chicago, where 700 people died. And at the time, we didn't know what heat waves were because it was a concept that wasn't really familiar. So we set up a big case control study to identify those most vulnerable to heat-related mortality. And we identified that people, particularly elderly, of course, that were socially isolated were most at risk from heat-related mortality. So based on all our medical risk factors, our environmental risk factors, social risk factors, we built these heat health action plans where we can prevent people from getting sick during these heat waves in the first place. So heat-related mortality in the US went down. I don't know if you remember, but then in 2003, there was a big heat wave that hit Europe. There was a statistical outlier when it came to the summer temperatures. And it turns out that something like 70,000 excess deaths occurred in particularly the southern part of Europe at the time. So the Europeans learned that they need to do something about heat-related mortality also, and adapted some of these features that we had identified in Chicago for heat health action plans in Europe. And as a result, heat-related mortality went down. Then guess what? The hottest period ever recorded in Europe was 2022 at the time. And as a result, now with epidemiologic modeling, we estimate that something like 61,000 people died in 2022 as a result of that heat wave at the time. And I don't know about you guys, I pay attention to the news to some extent, and 61,000 people, that corresponds to 300 airplanes crashing over a summer period. Did anyone pick up on that news? It's like, I didn't hear about that. So we are completely oblivious to the incredible impact of heat on population health. Then guess what would happen? 2023. Now this is the hottest period ever recorded in Europe. Another record. How many people died in 23? 47,000 people died as a result. Guess what? Last year, 24, again, the hottest period ever recorded, another record. How many people died? 63,000 people. What is wrong with us? Can't we build early warning systems that protect the most vulnerable, like the socially isolated that we identified in Chicago, particularly women, particularly the elderly? What needs to be done to stop these casualties from happening? And nobody of us pays attention. It's just incredible. So this is heat-related mortality. That's just one of the factors. Another issue is infectious diseases. And this slide here illustrates some of the challenges we're up against. It turns out that when you look at tropical diseases like dengue or chikungunya, they're transmitted by mosquitoes. It's a virus that causes these tropical diseases. In Europe, we see this exponential increase in cases in these arbovirus outbreak cases, so like dengue, chikungunya, or Zika, as a result of the warming. We see an exponential increase in the districts or in the areas that are suddenly at risk from climate change due to these outbreaks. And what you see on this slide here, this yellow and green, these are areas where the tiger mosquito, the Aedes albopictus, is currently present in Europe. It has invaded Europe, as you know, since the 90s. And these dots here correspond to the number of outbreaks that have occurred. And these outbreaks have exponentially increased, as I mentioned earlier. So we were interested in what causes these type of outbreaks. Why do we see this increasing trend? And when we do a multivariate analysis, we see that urban, semi-urban areas are at increased risk. We see that if a district has more imported cases from Brazil or Thailand, that increases the risk. If you look at socioeconomic factors like health expenditures, so 100 euros health expenditures per capita increases the risk for these vector-borne diseases. Does that make any sense? It makes sense to me because it turns out that if you set up a surveillance system that picks up on cases, that's how you detect the cases. That's why you see per 100, you see you're blocking the view there. So with 100 euros per capita, the risk goes up by 20%. And then, of course, temperature. So a 1 degree increase in the mean temperature increases the risk for these arbovirus outbreaks by 55%. So it turns out that in districts where they do not have the resources for surveillance, we have an increased risk for these type of outbreaks, and we will see an exponential risk for these type of outbreaks if we underinvest in health systems. So it is crucial to improve the health expenditure aspect of these outbreaks, because the most vulnerable will be the ones that are most impacted. And if you don't pay attention, this has a huge exponential potential, epidemic potential. So I believe that we might have to consider in the future that if you want to go to Italy or France on vacation, you might want to consider vaccine for dengue or chikungunya. This is the future that we might have to envision, and vulnerable people are specifically at risk. I'll roll it over to you.
Thank you very much, Jan. Another fascinating presentation. And now I would like to turn to Rita. Rita from the European Commission, and the European Commission has already invested quite a lot of funds into climate change and health research. We have this cluster of 6 research projects that both Jan and Vanya are involved in, but that's not all, is it? So can you tell us about the other things that you're doing and how you look at inequalities in that context?
Yes, good morning. You can see here in the left side of the slide the areas where we focus our work related to climate change and health in the Directorate-General for Research and Innovation. And you can see that we go all the way from fundamental research to implementation research. So we cover many of these areas that were mentioned before and many others, including also mitigation. And we published, you see there the publication in the right side of the slide. We published very recently a strategic research and innovation agenda on health and climate change. It is a very important document for us because it sets out the strategic vision and the priorities for the years to come in this area of research. We have been working on this document for 1.5 years, and it was published now in June. It was based on a wide consultation with stakeholders. And from this consultation, health inequalities, so the role of climate change in exacerbating existing health vulnerabilities and in creating and increasing health inequalities came across very strongly from this wide consultation with stakeholders. And for that reason, in the document of the agenda, we included a full section dedicated to health inequalities based on socio-economic health inequalities, also on demographic ones, and then the aspects of biological, physiological, health-related inequalities and vulnerabilities was embedded in all thematic chapters of the agenda. So now you might think, okay, the agenda is published, what happens next? We, the Commission, published also in July this year another important document that is the Strategy for European Life Sciences that aims to strengthen research in this area. And there we have a flagship fully dedicated to climate change and health research. The flagship has 2 actions. The first action is the implementation of this strategic research and innovation agenda. And one of the important aspects is that in the work program of research and innovation, our framework program of research and innovation, Horizon Europe, we will have in 2026, 2027, 170 million euros allocated to this area of research, implementing the agenda. So we really hope that these aspects that were identified as gaps and needs in the agenda related to health inequalities will come very strongly in the topics that we will be funding. Then another important aspect that I would like to mention is the second action. That is a multilateral initiative between funders at the global level that we are setting up together with Wellcome Trust, but with the participation of other funders. We want to align and coordinate the action in research at the global level in this area. And it's a very big opportunity also to bring these aspects of health inequalities and vulnerabilities to the center of the discussion. So we hope that we'll do that as well.
Thank you so much, Rita. So it's 170 million that we can look forward to sort of bearing fruit in terms of the research outcomes. Our remaining two speakers who have been sitting very patiently, I hope that you don't mind me calling you the bridges, the advocacy, the bridges between the world of research and the world of policy. Francesca, I know that tomorrow is a very important day.
Yes.
Well, every day is important, but tomorrow is the third and final hearing of the Pan-European Commission on Climate and Health, gathering the inputs from the experts. But please tell us more about the work of the Commission and what they hope to achieve.
Yes, thank you very much, Alexandra. And you are absolutely right. We heard the evidence, we heard the platforms, and now it is how are we trying to take this forward and bring it to the member states. And this is why this commission, the idea of setting up this commission has been unfolding. I think you can take down this slide because this is not the last one. So let's not be confused by that. The idea of setting up the commission came because we realized that a lot is already happening, but not at the scale and pace that is needed. And this came up already at the time of the Budapest conference in 2023, and this is why we decided and we thought that it would have been good for the member states to be able to come together and work through some kind of partnerships, learning from each other. But then we also thought we needed to do something else and bring this message at the policymaker level. But we need also to understand how comes that it is so difficult for member states to embrace this agenda at the political level. It is very difficult. You heard prevention works. At the moment, we have 22 countries in Europe who have implemented heat health action plans, okay? But we have 53 member states. What about the other 33? And of the 22 that have plans, how many are really being implemented? So Houston, we have a problem, right? So this is why we thought that having this independent, and I stress 3 times, independent Pan-European Commission, it is headed by the former Prime Minister of Iceland, Katrín Jakobsdóttir, brings together 11 commissioners. They are all very experienced, either policymakers or scientists, and they come together. They are free to roam the field however they like. And this is why they decided to look first at the threats. This was our first hearing. Second, at the exciting opportunities that exist for action based on evidence. And third, how do you take this into the political level? And this is what we are going to do tomorrow. And I have to say, I'm honored and excited to see that one of the panelists for tomorrow is here today, the Minister of Health from Slovenia. She is one of those who have kindly agreed to share their experiences with the ministers. So I hope that this is going to be a game changer, because we expect that by May next year, the Commission will come up with their call to action, with a resolve, with the very clear, pragmatic recommendations for member states to consider. And perhaps they will tell us, why didn't you look into this and that roadblock? perhaps we have to look more into how we tackle disinformation. How do we tackle the competing interests that may influence the political decisions? So we are very excited. I cannot wait to hearing from them. And I really hope that many of you, I know this is a competition with the forum, but you can connect tomorrow online and see how things will develop. And many thanks to all of those who have been a part of this journey, contributing to the hearings and contributing to the work of the Commission. Thank you very much.
Thank you, Francesca. And yes, we are all looking forward to the recommendations from the Commission. And last but not least, Vanya, you are also through EuroHealthNet activities connecting the world of research with the policy. Would you like to tell us more about it?
Yes, of course. So indeed, I'm here with the two hats, EuroHealthNet and the Cluster Health, that we will talk probably more about later. So we heard it, the impact of climate health is quite significant, climate change on health, rising and fluctuations of temperature, extreme health, extreme heat, extreme cold, droughts, wildfire, air pollution, water pollution, socio-economic inequalities related to that, climate-sensitive diseases. I mean, you name it. These individually are already major risk factors. Altogether, they are a major threat and challenge for our health systems. Intensify the pressure, lead to increase of cardiovascular disease, respiratory diseases. The data has been shown, more data is available. We know the drill, right? And those that suffer the most is always those that are the most in need, that are the most vulnerable. So EuroHealth has been carrying out various activities. We are part of various projects, collecting data. Actually, in particular, we try to translate evidence into policy recommendations. Here, I'm in particular wanted to point out of an initiative that we launched recently as a result of a very well-attended seminar that we had in June on climate and health, and it's a call for a EU strategy on climate and health. We saw there are issues that are not being addressed. Jon was showing how there is clear gaps in interventions. Yesterday I was in a meeting with a joint action on NCD. We were discussing about a scoping review on health equity interventions in public health strategies. And it caught the attention also from the various people in the room that most of these public health interventions are based on more typical risk factors, smoking and alcohol, but climate is not really there, not yet, and not in an integrated approach. So we need actions, we need coordinated actions. As Francesca was saying, we need someone to take the lead and to coordinate interventions across policies and across levels of governance. So Francesca mentioned the level of governance pretty well. And at the same time, the EU should consider integrate climate and health in various initiatives that they are carrying out. Climate, health are horizontal issues. They are impacted by various sectors, and they do impact various sectors. It all revolves also around the topics of social determinants, environmental determinants. So we have in the pipeline affordable housing, energy plan, anti-poverty strategy, European Pillar of Social Rights, the action plan, the revision of the action plan. Climate targets should be included into these, having the dedicated strengths. And talking about strengths, funding, upcoming funding, in particular in the next MFF, having a specific focus on climate and health. In general, funding allocated to climate objectives, we know now should be around 35%. Some argue that maybe it's not enough. I'm not really here to talk about that, but let's make sure that what is there is actually going to be allocated to meaningful and impactful actions toward climate and health inequalities have dedicated strengths. So yeah, we do have still a bit of momentum. The climate objectives are still high in the European Commission agenda. The Belgian presidency published some conclusions in 2024, asking also for a new action on health. Pan-European Commission, a lot of nice work also from the agency. So let's keep up the good work and have some impact in the future.
Indeed, let's keep up the good work. You've been listening to us very patiently, and now it's actually an opportunity for you to speak up. Please offer us your comments, your reflections, your questions, your ideas for the way forward, and you can do it by asking a question here or asking a question online. And another thing we would like to do, especially for those who would like to express themselves but don't feel like speaking up, we would like to run a Slido poll, which hopefully will appear on screen in a moment. You can see the QR code on the screen, and we would like to ask you to select 3 most urgent actions, in your opinion, that should be taken to address climate-driven health inequalities. So I hope that you can multitask and complete the Slido poll at the same time as thinking about the questions you would like to ask. I can see a hand already. There is a question. If you could please introduce yourself. Thank you.
Thank you very much. I'm Charlotte Marchandise. I'm the Executive Director of EUFA, European Public Health Association, and I'm also former Deputy Mayor in a healthy city. 2 questions. One is really everything you said about Chicago, everything you were presenting, all the answers are local. All the answers depend on public health frontliners, community workers that are not in Gastein, that are always missing, that we speak about, but do we really represent their voice? And one of the really things we try to implement is how we empower public health workers from communities with training, with professionalization, recognition, and unity in Europe, which is really missing. If we want them, healthcare workers, doctors are unionized. Public health workers, we don't know them. And that's why also our voice is so low on MFF, on all advocacy and championing. Second thing, NGOs are super important, but for both health and climate, we're being cut in the European Union. I mean, political agendas are fighting against NGOs, are fighting against grants, and we need to unite for that too, because lots of us, we are taken away all our means to advocate for this very important matter. And I think this is a big political issue. And again, how do we work together? Thank you.
Thank you so much. Would anyone like to reflect on that? Jan and Francesca.
Yeah, thanks. That's a great question, and I totally agree with you. Right, the healthcare, the public health workforce needs to be strengthened. There's another aspect I would like to stress. It's something that I call lateral public health. We're supposed to have vertical public health, where we have top-down programs to eliminate smallpox or polio, all these effective programs. We need to reconsider the strategy if we're dealing with something like climate change, because it has to be something that's integrated in community. And one great example is in Nepal, there is a river that branches into 2 branches. And in 2006, they established a great warning system on one branch of the river, where the community was involved in the early warning system. They were involved in the response. They built this hierarchy of command, reading the river gauge and all that to prepare for flooding. In the other river, they didn't do that. So they established a system, but there was no community buy-in. The community has to be part of it, and this is what we work on with the Commission, try to build this co-development of these type of programs. Otherwise, it doesn't work. And then guess what? In 2012, there was the biggest flood ever that occurred in Nepal, and the river was flooded. And in the community where they were able to engage the community, they sounded the alarm. They were able to reach out to the entire community to move the assets out of way, the movable assets were brought out of harm's way, and people didn't die, in comparison to the natural experiment next door where thousands of people died. This is where it's at. And we need to learn from the global south here in the global north if you want to address this issue like climate change. Heat cannot kill 60,000 people a year. We need to change our approach.
Thank you so much, Jan. And Francesca, you also wanted to respond. And Rita.
Yes, on your first point, Charlotte, this is so important that again, speaking about the Commission, they've decided that they want to have a fourth special hearing. It will be on the 3rd of December about cities and regions, because there is so much understanding of where is that the change needs to take place. But again, if we think of the governance, it is a continuum. No? You need a very supportive framework at the national level for action to be enabled at a subnational level wherever it takes place. And you also need the openness to be inspired by what happens locally, because very often you have new solutions that emerge from cities, and then you may want to be able to scale that up. Thank you.
Rita?
Just to add briefly that I totally agree. It's very important to bring these voices to the work we do also at the Commission and from the side of research. I can tell you that we, in the consultation leading to the publication of the agenda, we had a consultation with the NGOs that was very useful. And these aspects that you mentioned involving the users of these solutions in the development of the solutions, and also involving healthcare practitioners and healthcare workers in implementing these changes was really part of a lot of feedback that we received, and we include it in the agenda. Of course, now we need to work on implementing it. That is a very big step as well.
Thank you very much. There is another question from the audience.
Thank you very much. My name is Elisabeth Campestrini. I work in mother-child health, currently focusing on the Western Balkans, and I would like to raise the situation of children in this regard. UNICEF, in fact, published a report this year that 1 billion children are affected by air pollution, weather-related risks, and many other factors, obviously. We know the Global South is affected, particularly, but also in big cities in the more developed countries. Heinrich Böll Stiftung has undergone a study in 7 leading German cities where the inequality between urban areas has been reflected with the impact of the environment on the children adequately. However, there have also been proposed some solutions by UNICEF, one focusing on child governance on policy level, and the other focusing on the situation that research and policy together can achieve in this regard. So my question to all of you, do you know of best practices, and what do you advise to have child-centered governance on a national and global level? Thank you.
Very tricky question. Anyone? Maybe I can just mention that the European Environment Agency also published a very short report a couple of years ago looking specifically at the air quality impacts on children and estimating, I think across Europe, 1,200 deaths occurring every year among people under 18 years old as a result of air pollution. So indeed it's a very crucial matter to address, but how can we engage actually children and youth into that? Francesca?
Yes, thank you very much. I think this is one of the big winners, politically speaking, because those of you who have been around long enough will remember that in 2004, there was a ministerial conference on environment and health, on children, health and environment was the theme. And at that time, the European Commission also launched its first plan on children's health and environment, if you remember. So that was a very positive point in time politically to have children as an entry point for that. Now, perhaps I'm speaking a bit in a way that may sound slightly cynical, but the truth is, if we really want to change, we need to understand what are the levers and the political entry points at any given point in time. So for us as a WHO, air quality is a main risk factor. It is, it kills more than 500,000 people per year in the European region. But what we are trying to do now is to link this agenda, the air pollution agenda, to the climate agenda, and to tell people, listen, if we are mitigating climate change through measures that reduce air pollution, we will multiply the health benefits, beginning with the most vulnerable ones, with children. So it is also a way of crafting that and then using the opportunities. For us, I think it is extraordinary that the review of the air quality directive in Europe has been making a clear reference to the new WHO air quality guidelines, because this is where you can really make an impact on millions of people. And there, it doesn't matter to which quintile of the population you happen. Better health, better air will be better air for all.
Vanya, do you also have a comment?
So very quickly, as I mentioned, we are part of the cluster health. We are 6 projects. One of these is called High Horizon. It's not a project that EuroHealth is involved in, but they do focus on maternal health, children, infants, postpartum, and they look in particular at their exposure to extreme heat. I just wanted to shout out, they have various publications on issues, including conceptual frameworks for policy interventions that might be interesting for you.
Thank you. I think we have time for one more question, and I can see a question over there. Yes, you, Andrea.
Okay, thank you. I already had the microphone, so I was in advantage. Yeah, thank you for this excellent panel. I'm really happy to hear about this topic here in Gastein. My name is Andrea Schmidt. I lead the unit on climate and health at the Austrian National Public Health Institute. And I think some of it was touched upon now in Francesca's response. But I was interested in, could you maybe elaborate a little bit what could be possible governance or funding mechanisms to bring this agenda forward, both at the national level, at the local level, but also, of course, at the European and at the international level? Thank you.
Thank you, Andrea. I think it's we really need to break a little bit of a deadlock here, because on the one side we see that there are several funds that are available internationally by different donors. There is the Green Climate Fund. There is this new platform that the European Commission is developing. There has been, and there is the European Green Deal. So but there is a lack of capacity, particularly I have to say within the health sector, to get and to become proficient into using these opportunities. So I think that there we need to do a better job, and I'm speaking also from the WHO perspective, into increasing these capacities and letting people feeling empowered that they can, develop an access, and they can scale up the engagement into mobilizing the resources that are needed. So you are one of our key partners. We have a platform where we are discussing together with the member states about the practices, and perhaps this is one entry point to continue this kind of peer learning with each other. Then also within governments, how do ministers of health effectively advocate for resources to go into environmental resilience of health systems, climate resilience of health systems. But we need to do a much better job at that, because it is a relatively new agenda item, Tobacco has been on the public health agenda for 50 years. We know that. We know how to maneuver into that. Climate change for the health system is something that has been on the agenda for less than 20 years, I would say. So we have to catch up.
Yeah, from my side, I would like to also build on what Francesca was saying and agree and second that we really need to identify the key actors and to invest more and do a better job in connecting these different levels of decision making and make them work together, communicate, align better so the impact can increase. From the side of research, we see that a lot of evidence is available. We need, of course, to collect some more in some specific areas, but we need to work more on scaling up, on implementing, on facilitating the use of this information to implement actions in climate change and health. And I think that's a very important point that we need to work on in the coming years.
Thank you very much, Rita. Naomi, could I please ask you to reveal the results of the Slido poll, and let's learn what you think are the most urgent actions to take to tackle this crucial issue. Wow. Yes, I think it's, it's staring us in the face that, if we want to reduce the inequalities related to climate change, we should be focusing really on reducing the inequalities overall, and also on adapting how we live, where we work, and focusing on groups with multiple vulnerabilities. Very often we take this siloed view, looking at the elderly, the children, those with pre-existing health conditions, but how about the individuals that might be affected by multiple things at the same time? So thank you very much. Very interesting, and yes, I would like to spend the last 12 minutes of the session asking the panel to reflect on that. What do you think about those findings, and how do they resonate in what you have planned in your work? I'm sorry, we have to sort of turn a bit awkwardly to see the results, but maybe looking at the importance of the working environment. Maurizio gave us all those results, but is there something that you are planning to do to address those from the European agency perspective? So if you could just in 2 minutes summarize that.
Yes, thank you very much. I was mentioning that we started this research program on the impact of climate change, the implication of climate change for occupational safety and health. Here, I think that I can say something about the second point, because we, with the results, the findings of this research activity, want to support stakeholders and workplaces in particular to adapt the work environment, to adapt the workplace, to protect workers, to prevent risks related to climate change. So our plan is to produce a number of practical tools, including checklists or risk assessments that are obviously covering the aspects related to climate change, and to make them available to all the workplaces and stakeholders in Europe. The idea is as well, obviously, we would like to promote the idea that the involvement of workers in designing these measures is crucial. The question about communities, if we look at the community of workers, the involvement of the community, it's crucial in this respect, or their leader, I mean, trade unions and their representatives. We see that this is not really the case across Europe, and sometimes measures are deployed in the workplace without consultation, and these are measures that are not likely to succeed. So we will, stay in touch and because stay tuned, because we will provide this information, knowledge, etc., available to all stakeholders. Thank you.
Thank you. What I can see or can't really see on this slide is the issue about expanding our knowledge on the impacts of vulnerable groups. And a question to Vanya and to Jan. You are both very firmly embedded in the research on vulnerability and climate change. Do you think we have sufficient knowledge on the impacts and we should maybe move on to focus on solutions? How does it resonate with what EuroHealthNet and Lancet Countdown have in mind? I think Vanya had his microphone up first, so I will turn to him.
Thanks. Well, I'm actually going to use this as an assist also to talk about the work that is carried out by the various projects of the cluster. Very quick shout out Catalyze and High Horizon on heat exposure, ID Alert and Climos on vector-borne diseases, Blue Adapt on coastal pathogens, and Trigger on overall on helicopter view, and particular good work on air pollution. So most of these, if not all of them, are working on improving surveillance systems. And they do so by integrating disaggregated, using indicators to collect disaggregated data according to age, gender, occupational health, socioeconomic status. This is very useful because the surveillance systems are then connected to public interventions. So they are used to develop interventions that are tailored to specific communities with people and groups with specific vulnerabilities. They identify what are those in most risk and what kind of actions are needed. At the same time, they often are connected to the groups themselves, directly or indirectly. They're able to develop early warning systems that reach people in time, so for timely intervention. What's interesting, though, is that when we look at the recommendations, we always have, indeed, timely intervention, so that who needs to be reached out right now, it can be done in a timely manner. But if we do want a structural approach to it, inequalities needs to be well integrated in a long-term view. So social inequalities impact, exacerbate already existing vulnerability. The size of the groups that are impacted by extreme extreme weather, climate change in general, increases. The cost to reach them increases. Perhaps new pocket of population increase if inequalities increase. So, and then we need to identify them, develop new interventions. So it's clear that social inequalities and the roots of them need to be addressed hand in hand with terror intervention right now. So the cluster is developing a lot of evidence on this, and we are also working on a policy brief. By the end of the year, should be done. So stay tuned, because a lot of interesting information will be there.
Thank you, Vanya. Jan, 2 minutes.
So I mean, of course, I'm totally in favor of conducting research on impacts and all that, but I think we're running out of time, right? So we need to come up with solutions. And one good thing about the mitigation strategy is that there are lots of co-benefits of mitigation. So if you reduce greenhouse gas emissions, there are co-benefits for public health, right? So if we reduce combustion, then we have improvements in air pollution and children's health, and there are so many co-benefits to that. One thing I think we need to think of as part of the Lancet countdown to come up with other strategies to support these kind of transitions. And obviously, a carbon tax is something that we need to consider. But guess what? We cannot roll over the carbon tax to all the farmers that need to have the diesel to ship your food into the cities. We cannot roll over all the responsibility of mitigation to the vulnerable groups, in this case, the farmers. We need to find a way to tax those entities, the vested interest group that I'm talking about, the fossil fuel industry, that produce all the fossil fuels that we are subsidizing. Guess what? You're taxpayers. You as a taxpayer, you're finance the oil industry. We need to change that. We need to have solutions quick. Otherwise, the farmer's going to go and invade Paris and Germany, you name it, because they are right. They're right. We cannot roll over that responsibility to them. We need to think outside the box to turn that around.
Thank you, Jan. Rita, looking at the Slido poll that has now gone, but I think at the 4th place there was this issue of breaking the research and policy silos. I think that you've taken really a big step towards that through the strategic research and innovation agenda, but also through collaboration with the Wellcome Trust and so on. How do the other findings resonate with you? And what do you have in store for the next years to take more action?
I found it interesting in the slide, though, that many of the options were coming, although, yeah, but many of the options were coming more or less equally voted. So it seems that a lot of aspects are still needing attention and investment. It was also curious to see that the last one was more evidence. I agree that we really need to move to action, to use the evidence we have. We still need to collect some more, but we need to move to action, to implement, to solutions, to tools that can be used. And we need always to keep in mind that it's very urgent to react to climate change, but we want scalable solutions that are applicable to a wide range of settings, but we need also to make sure that vulnerable populations are considered in these solutions, and we cannot develop the solutions and the tools to the general population and forgetting these groups. That's my main takeaway.
Thank you. And to finish off the session with Francesca, and how do the findings of this slide poll resonate with you, and what further work, apart from the Pan-European Commission, the WHO Europe has in place?
Thank you, and super interesting, I have to say, the result of that, because to see how much emphasis this group has placed on addressing the upstream determinants, I have to say is a very heartwarming. And this is because at the end of October, member states will come, as every year, at the Regional Committee for Europe. It is the gathering of all the ministries of health of the region. And they will be invited to consider the European program of work, the new one for 26-30, where climate change will be one of the key priorities, but where addressing the inequalities is a cross-cutting theme there. And I think that what comes from this room, my reading at least, is that there is a strong understanding that if we were able to address some of these upstream determinants, I'm not saying that automatically risks when it comes to climate change will be addressed. No, far from that. But we will be much better equipped to do that. From, let's say, more closer to the topic, this is one of the directions that we are taking now with the revision of the WHO guidance for health action plans that we intend to publish, will be published in the first semester of next year. So many partners here are contributing to that work, so thanks to you. But I think it is important to see that the effort in reviewing that has been to place more attention, for example, to the relation and to the importance of modifying the built environment. Because modifying the built environment means to create the upstream and the preventative conditions that, for example, may reduce heat islands in cities, may reduce exposure, and the emphasis on reducing exposures, together with the communication package. So there is an exciting pipeline here that we are taking forward with the partners, the European Commission there, the agency, and many of you here in this room. And I'm just saying, please continue to be such a great partners for us and help us really addressing the upstream determinants, because this is where we will maximize the multiple health co-benefits. I know sounds like co-benefits, but it is good for the cities, it is good for the countries, it is good for society, and at the end of the day, for the economy.
Thank you very much. Unfortunately, we are coming to the end of the session. I think it's a subject that deserves much more than 60 minutes. But thank you so much. You've been a wonderful audience, and thank you to our fantastic panel for sharing all those insights with us. And I think we can conclude that this subject is not going to go away and requires more work. From our side, the European Climate and Health Observatory, its partners and friends will continue our work to develop the knowledge and share the knowledge. In terms of the next steps after this session, we will do our best to write it up. The questions, also the questions that we, from online audience that we didn't manage to get to, and we will include it in the European Climate and Health Observatory portal. So thank you very much. Enjoy the rest of the conference, and please give a big hand to our fantastic panel.